Hi, this is Dr. Peter Grinspoon. Thank you so much for listening to my YouTube channel. Today we're going to talk about what young doctors are being taught about cannabis, which is a really crucial topic. Before we get started, please remember to press the button that says subscribe to my YouTube channel. It's free, and then you can get access to all kinds of content about drugs and about a lot of other interesting topics. Now today we're going to talk about what do doctors get taught about cannabis, both in medical school and when they're studying to be addiction specialists. There's a huge disconnect between doctors and patients on cannabis. And I think through a recent experience, I gained some pretty interesting insight as to where this disconnect comes from. To give a little background, I work at the addiction clinic in my hospital. We provide low threshold care to people from any walk of life. People without homes, people unhoused, people without jobs, people without health care, people who are really sick. And we do a great job taking care of them. Addiction is not an easy disease to treat, but we really take good care of them. And as a complement to this, I thought I'd take my addiction medicine boards. It's just a test to see and to prove that you know a lot about addiction. It's not my favorite kind of test. It's 200 questions in 4 hours. You're like really stressful making you do that. But anyways, I took the test, and to take this test, I studied a lot. And studying for this test to become an addiction specialist, I learned so much about treating people with opiate addiction, with alcohol addiction, cocaine, methamphetamine, benzodiazepines. It really was spectacular how much thought and effort this whole field of addiction medicine has put into treating people. And even though it's a difficult disease, how successful they're becoming. For example, using methadone, which we prescribe, or buprenorphine Suboxone to help people prevent overdoses. And so I enjoyed studying most of the material, the curriculum for the test. But the stuff on cannabis blew my mind. It was really amazing because they just talked about the harms of cannabis. They seemed to have an assumption that all use is misuse. And cannabis and other drugs, most people who use it without problems. They don't get addicted and they don't have any other problems. So all use is not misuse. They also called cannabis a quote unquote illicit drug, which makes people think it's like PCP or heroin. And in fact, it is still federally illegal, but it's legal in 38 states for medical uses and for 24 states for recreational uses for adult use, and it's legal in several other countries. So I sort of question the illicit cannabis use. But the main problem is that they just talked about harms, and some of the harms they talked about weren't actually accurate. I've been studying this for my whole life. I've been practicing medical cannabis with patients for 25 years. And they didn't seem to factor in that tens of millions of people in this country alone are using medical cannabis with really good benefit, and some people with harms, but a very small minority of them are being harmed by cannabis. Most of them are using it and are really successfully alleviating their symptoms of like chemotherapy-induced nausea and vomiting, chronic pain, anxiety, insomnia, colitis, fibromyalgia, multiple sclerosis, a lot of symptoms that we're just not good at treating with traditional pharmaceuticals, and which we could treat more safely and with fewer side effects with cannabis. In fact, a lot of these patients, for example, chronic pain patients, are able to get off their opiates with cannabis. And a lot of, for example, insomnia patients are able to get off their Ambien. And you can't argue that cannabis is more dangerous than Ambien. So it was really weird to read a lot and do a lot of practice questions about cannabis when it was very, very one-sided. It really made me wonder and sort of understand why the field of addiction medicine has been opposed to cannabis all along. I mean, as an aside, it's very interesting. In general, a doctor's perspective on cannabis tends to do with his or her vantage point. For example, it's hard to find an oncologist that doesn't support medical cannabis because they see it helping people with their nausea and vomiting. So something like 90% of oncologists support medical cannabis, where on the other hand, like you take the adolescent psychiatrists who see the relatively rare but really tragic cases where cannabis is likely contributing to these young people having psychotic episodes, and they tend to overgeneralize and be pretty anti-cannabis. And most doctors are in between. About 2/3 of primary care doctors support medical cannabis. We're getting there and we're heading in the right direction. But again, you can't judge a medication just on the harms and not on the benefits, right? Look at aspirin. If we just looked at aspirin as something that causes allergic reactions and bleeding, and we didn't factor in that it prevents heart attacks and strokes, aspirin would be this horrible, horrible substance. You can't just look at the harms. Another example might be I treat a lot of people with penicillin for strep throat. It helps most people. They get better, end of story. A small percentage of them have very serious allergic reactions. If you just look at the 1 in 1,000 people that have allergic reactions, and you don't look at the 999 out of 1,000 people that do well, you're going to think penicillin is an awful drug. And I genuinely think that the way they treat cannabis falls into this trap of not understanding it. They seem to either never have gotten the memo, or the addiction field hasn't read the memo that most people are using cannabis with benefit and more than they are with harm. And nobody would argue that there aren't harms of cannabis. We have accidental overconsumption. We have kids taking it by mistake because they're packaged stupidly as yummy edibles. You shouldn't drive on cannabis. It's not thought to be safe for teenagers, pregnant women, breastfeeding women. It does contribute to psychosis in younger people. People get a vomiting syndrome called cannabis hyperemesis syndrome, and it can be addictive. That's very complicated, the rate of cannabis addiction. I've talked about that in other writing and in other videos. So no one sensible would deny that cannabis has its harms. But again, this curriculum was unbelievable about how it focused on the harms. Some of the practice questions blew my mind. One of them went along the lines of, a person has used cannabis for 10 years. Well, no, a person had to change their job to a less technically demanding job because they used which drug? And the answer was cannabis. Now, some of the other answers were ketamine and DMT, that crazy hallucinogen that makes you communicate with space beings. And, it's just kind of ironic. If you take a lot of DMT, it certainly doesn't do wonders for your ability to do technical things at your job. But the fact is, cannabis can help people think abstractly, and it can help them with some of these technical issues. And this question mixed together two different cannabis myths. Number one, the cannabis makes you amotivational, and number two, the cannabis makes you dumber. Number one, cannabis does not make you amotivational. The whole amotivational syndrome was simply a creation of the war on drugs. Some of the most motivated people I've ever met have used cannabis. Like my dad, spectacular physician, he passed away, but he wrote 180 scientific papers and 11 books. I mean, he was a cannabis user. Or the great astronomer, Dr. Carl Sagan, he was a cannabis user. He won the Pulitzer Prize for his wonderful book, Dragons of Eden. And I remember at the same time, he had the #1 New York Times bestseller on both the fiction and the nonfiction books. So there's no such thing as a motivational syndrome. It was really just made up. And the second myth, that cannabis makes you dumber. There is no evidence that cannabis makes you dumber. There were a few studies that showed that cannabis lowers IQ, but they didn't factor in other things that can make you score lower on the standardized test, such as other drugs and alcohol. Smoking, they didn't factor in these other things. And then when other researchers went and reevaluated the same data, there was no drop in IQ. So cannabis does not make you dumber, and there's no such thing as amotivational syndrome. But if you give questions like that, people are going to internalize these things as true, and they're going to be really worried about them. There were no questions on which disease does cannabis help people treat the most. So again, it was very, very one-sided, and I'm very worried about that. I spent a lot of my time educating physicians, and I think all physicians need to do a better job. The reason it's important to have physicians educated about cannabis is multifactorial. Number one, the doctors need to understand the basics. So they understand the drug, and they understand the drug interaction. We don't teach the endocannabinoid system, that whole system of neurons and neurotransmitters and receptors through which cannabis works, that modulates so many things in our bodies. And we need to teach that in medical school. Something like 13% of medical schools teach it. It's crazy we don't teach it. It's like not teaching the epinephrine syndrome or the dopamine system. To understand the harms of cannabis as well as the benefits, you need to understand the endocannabinoid system. So doctors who are taught very little in medical school, internship, and residency, and doctors who are subjected to this sort of one-sided education, particularly the addiction specialists who see cannabis all the time, and need to understand, for example, the cannabis can be addictive, though it's sort of exaggerated. It doesn't, also the cannabis addiction doesn't kill you like opiates or alcohol withdrawal can, but that people can use cannabis as a gateway out of opiate or alcohol addiction. I mean, there are two sides to this which are really important, and we could be using cannabis to significant benefit. And then when doctors have an overly negative view about cannabis, even if they have the best bedside manner in the world, this stigma and this judgment just seeps out to patients. And what happens to patients is that they clam up and they won't say a word. And it's critical that doctors create a climate where any patient can talk freely about cannabis or any other drug use, or you're going to end up killing people. If the patients won't talk about it, you don't know they're using it, you can't talk to them about side effects that are real. Fortunately, we're slowly heading in the right direction. The field of internal medicine, the primary care doctors are slowly starting to embrace medical cannabis, or at least respect and understand. Number one, the patients are using it, so we need to talk about it and not judge them. And number two, we need to learn more of like practical, sensible information so we can have conversations with them where we actually provide guidance on how to get started, how to not take too much, and how to use it safely. As it is now, patients don't feel, by and large, like doctors are reliable partners, and they end up getting their information from other people. Like, for example, most people, according to polls, get their information about what type of cannabis to use from the bud tenders, these friendly and enthusiastic cannabis enthusiasts at the dispensaries. But the bud tenders aren't trained medically, and they wouldn't know about medication interactions. It would be so much better if the doctors knew enough practical information. You use a little bit of CBD, start with 1 milligram, work your way up slowly. These are the effects to worry about. If the doctors could talk with the patients openly and honestly about their cannabis use. So I think we need to really overcome a lot of the myths of the past, to overcome a lot of the stigma, really pay attention to the curriculum, both in medicine in general and particularly with addiction medicine. And we need to sort of get along in the modern times and meet the patients where they are. And if we do that, the use of cannabis will be much safer for everyone, and we can have people have access to medical cannabis for vitally needed symptom control like chronic pain or nausea and vomiting or insomnia. And doctor and patient relationships will be much healthier and much more robust for all of this improvement in communication and knowledge. This is Peter Grinspoon. Thank you again for listening to my YouTube channel.